My name is Rachel Schmidt, and I come to you today from Sequoia Wellness Center in Rootstown, Ohio, actually from inside my home, to share with you a few techniques that you can use for yourself at home during this quarantine to help you relieve any migraines or headaches while you're away from your massage therapist. So let me start off by saying at any point in this video, if you would like to pause and go back to rewatch or practice any of the techniques, please feel free to do so. You might want to pause after each technique to practice a little bit deeper on your own and then continue. So there are actually seven types of headaches that I want to talk to you today about. The first would be migraines, of course, but there are also headaches that stem from digestive issues. We have stress headaches, tension headaches, sinus headaches, anxiety headaches, and then headaches that can stem from TMJD, the temporomandibular joint dysfunction that you can have if you struggle with clenching your teeth at night or tensing up your jaw, or if your jaw lays a little differently in alignment with your temporal bones. You might feel some pain, and that can definitely cause some headaches. So our goal is to kind of free up some space between the facial and the skull bones. I'm not going to run through all the facial bones or all the skull bones because this is not an anatomy lesson, but I will mention a few and I'll let you know which ones they are. For example, the zygomatic bones I'll mention are your cheekbones, your mandible is your jawbone, and so on. So I have actually been training in craniosacral therapy, and a little bit about the craniosacral system. The craniosacral system is a rhythmic mobile activity of your cerebro-spinal fluid, which creates a ripple effect from the very core of your body and persists throughout life. So you have this cerebro-spinal fluid, the CSF, running through the very core of your spine and inside the connective tissue called meninges on the inside of your skull. So the cerebro-spinal fluid, the CSF, is totally separate from the blood. These meninges separate the craniosacral flow of the CSF from the cardiovascular flow of your blood. And certain meninges help give the cerebrospinal fluid nutrients from the blood. So our goal is to kind of free up space within the skull bones, the facial bones, to help the flow of your craniosacral system have a more regulated or normal amplitude and quality of that cerebrospinal fluid flow throughout your skull and your spine. So there's a technique called V-spread where you access two bones that come together. Let's say, for example, your temporal bone and your parietal bones. So you find this little divot, kind of like a ravine, in between the temporal bone and the parietal bone. If you're not familiar with the bones of the skull, you might want to look up a picture on your computer. But you'll find what feels like a little divot, and then you're going to put two of your fingers on each bone. So one finger is on the temporal bone, one finger is on the parietal bone, and then just gently make contact with the connective tissue. And you don't need a lot of pressure for any of these techniques. About 5 to 10 grams of pressure would be enough just to maintain a firm connection with the connective tissue, and then direct the motion of the connective tissue in the direction that you want. So you want to exactly shift the connective tissue apart from each other. So I'm moving up with one finger and down with the other finger because the temporal bones are lower than the parietal bones. But now let's get into migraines. Felt on the side of the head, usually in one spot, and it can cause disturbances in your vision or your hearing, like vertigo. So there's a technique called the parietal lift. So you just contact that ravine between the parietal bone and the temporal bone, that little divot where they connect. And then you gently direct your pressure and caudally towards the head or above the head from the temporal parietal ridge. So go ahead and try and find that contact. And once you get there, all you need is 5 or 10 grams of pressure, and gently push in to contact the connective tissue, and then direct your pressure in an upward fashion. Another good technique for migraines is finding the connection between your frontal bone and your sphenoid bone. Your frontal bone would be your forehead, and your sphenoid bone is actually inside your skull, which houses your pituitary gland and your pineal gland. So it's a very important spot. It rests just right above your spine, if you can imagine that. So what we're going to do is kind of press our thumbs right underneath the brow bone, right underneath the part of your frontal bone that your brows sit on. You don't want to press directly into your eye sockets, of course. Don't do that. But just find your eyebrows, move down about a finger's width, and just direct your pressure, make contact, and direct the pressure in an upward fashion. You can use your thumbs or your fingers, whichever finger you want. I just use like totally opposite fingers. You can use your middle finger, pointer finger, or even a couple fingers. Whatever feels best for you. Take a deep breath and practice that for a moment. So next, I'm going to talk to you about the digestive headaches. Felt in the temples, around your eyes, across your forehead, usually accompanied by stomach, kidney, or any kind of intestinal issues, overindulgence in food or alcohol, or any sensitivities to food like allergy symptoms, like maybe you ate the wrong thing and now you have a headache. So there's an ancient technique called drilling bamboo. So since digestive headaches are felt in the forehead, you take 2 of your fingers, your first and second, put them on either side of the top of your nose, but more so in between the eyebrows. Make contact, pressing inward, and then gently direct your pressure in an upward fashion. And this is drilling bamboo. And since also the digestive headaches are felt around the eyes and in the temples, you can direct a small amount of pressure on the outside of the eyes, which can help, gently moving one finger width at a time to the outer edges of your temples, and just press in lightly here. Maybe go back through it again. So stress headaches. Stress headaches are felt in the back of your neck and continue all the way up to the very top of your head, to where your mid-sagittal sinus exists. You have a sinus right on the top of your head. So for the stress headache, you can actually use the V-spread technique and just use both of your hands here. Find that mid-sagittal sinus where your two parietal bones meet together at the top of your head. Just gently make contact, press in, and slowly direct pressure out to the sides of your body. So we're pulling out here. And you want to maintain really relaxed during all of these techniques so that you feel the full extent of the subtleness of your skull bones and your facial bones being allowed to separate and make space for that craniosacral flow. You can also do a gentle sphenoid compression and decompression. For sphenoid compression, access the temples, move a couple fingers out from the sides of your eyes, make contact, and then direct pressure posterior or towards the back of your body. So don't stretch your skin at all, just maintain that connection with the connective tissue. And take a break. For sphenoid decompression, we're going in the opposite direction, so anterior, in front of our body. So making contact with your temples, go ahead and direct pressure towards the front of your body. This is sphenoid decompression. So the next type of headache we're going to talk about is the tension headaches. Pain from the back of your neck all the way up through the top of your head, meeting at your forehead, is triggered by constant tension held within other muscles in your body. So since everything is connected, start to relax one area of your body at a time to see if you can just notice where this tension might be stemming from. There is a pressure point at the back of your head at the IOP, inferior occipital protuberance. I'm going to turn around so you can see that real quick. So starting from the middle of the back of your head, where your occipital bone is, move out about 2 finger widths until you find those little dips that your spinal muscles make, where you can just fit your fingers right in there. So all of your spinal muscles are running down your spine and connecting to this bone in your skull. So imagine that every time you have a backache or you're using your back muscles for any kind of strenuous task, all of that is leading back to your head. So this can be a huge reason for headaches. So go ahead and just press in an upward direction, directing your pressure upward to just compress these spinal muscles attachment to your occipital bone. You might want to move your fingers around a little bit just to see where it feels best, or kind of move your fingers around to give your head a little more of a massage rather than just a pressure point. And there are also a couple restorative poses I'd like to show you that you can use to release a tension headache from the forehead, and by correcting or redirecting the cervical spine's curve by placing a rolled up towel under your neck and taking pressure off the low back, keeping the spine in alignment again by putting a bolster or a pillow underneath your knees. So I'm going to show you a couple of those now. If you need to sit up on a block here, or your meditation pillow or any kind of pillow, go ahead and do that. And I have some yoga blocks here, as you can see. If you don't have yoga blocks, you can stack some pillows or some pillows and kind of a soft paperback book, because you want something a little more solid to rest your forehead on. So you can sit down with your legs open wide, is probably the best way, or crisscross. And you're just going to lean forward and press your forehead on this hard surface and just gently rock from left to right to massage out your forehead. And that can release a lot of tension in the traps, stretching out your spinal muscles because you're leaning forward, and also massage that frontal bone and those frontal face muscles. Our next one here, as you can see, I have my bolster for underneath my knees to take pressure off my lower back and lumbar spine. And I have a towel rolled up into kind of like a cylinder shape to place underneath my neck. You can do this on a bed. The best place for it might be the floor, because you get a little more of that solid surface for whatever is going underneath your neck to lay on. So it's pressing just lightly on that cervical spine, because we want to redirect that curve to take away any tension in the spinal muscles. So just like this, and take a few moments to relax here. So the next type of headache we're going to talk about is the sinus headache. Inflammation of the lining of one of the 8 sinus cavities can cause deep, dull pain or discomfort around the eyes, nose, or head. So obviously, sinus headaches can be caused by a cold or allergies, and it is definitely allergy season right now. So hopefully this helps you if you're experiencing any of these things. There is a pressure point right in between your vomer, or I'm going to call it your nose bone, which connects to your frontal bone. But if you can imagine, going inside, your sphenoid bone is right behind the nose and lower from the frontal bone. So in between your vomer and your frontal bone, you're almost accessing that sphenoid bone and helping create a little more fluid flow through there. So go ahead and find right about where you feel maybe a tiny divot. You're not going to feel much, but it is there. Right where the vomer, the nose bone, meets the frontal bone. Press in with one finger, and once you feel kind of a tenderness, again, don't use more than 5 or 10 grams of pressure here. You will feel a certain tenderness, and just start to direct pressure upwards without moving the skin. You're just contacting the connective tissue and directing your pressure upwards. And it will feel really good. Our next technique is sinus pumping. So you feel a sinus headache around your eyes, through your nose, cheeks, and you can actually take 2 fingers and just lightly press underneath the eyes. And if your fingers are kind of cold, this might feel really good too if you have sinus allergies right now or any kind of sinus congestion. And then slightly move down, go to the side of the nose, press 2 finger widths at a time out from the sides of the nose over the cheeks. And then moving down, you have 8 sinuses in your head, so we're contacting almost all of these sinuses right now. We already did the V spread at the top of the head for the mid-sagittal sinus, so that will also help with sinus headaches. But so moving from the cheeks, you can find right above your lip, but right below your nostrils, a pressure point going from your maxilla the bone that carries the top of your teeth, and your zygomatic bones, your cheekbones. And you're going to press right about in there where you feel like you're feeling that bone, but your fingers can go in a little bit deeper than they can if you're pressing on your cheekbones. So once you make contact with this connective tissue in between the maxilla and the zygomatic bones, start to again direct your pressure upwards. And I might look a little silly right now, but this can really help relieve congestion in the nose. So go ahead and practice that for a few moments. The next type of headaches that we're going to talk about are anxiety headaches. So basically, we feel anxiety headaches right across the forehead, and that's usually where we feel our anxiety. But if you're having or experiencing anxiety, you might feel like you have a shortness of breath, or you're constantly trying to catch your breath. And you want to make sure that if you're ever experiencing anxiety, that you notice every time you have to go and sigh, because you realize you weren't really breathing your full 4-second inhale to 6-second exhale, but you were actually taking very shallow, quick breaths because you're feeling anxiety. So as we do this technique called the frontal lift, I want you to count in your head, inhaling up to 4, and count in your head, exhaling down to 6, 6, 5, 4, 3, 2, 1. Go ahead and use your 4 fingers to place your fingers across your forehead. Your pinky finger is going to lay right on your eyebrows, and your middle fingers will probably come to touch. And just lightly make this contact with your forehead, very lightly. And once you feel that all of your fingers are pressing firmly against the connective tissue, start to gently direct your pressure in an upward fashion, lifting the frontal bone away from the sphenoid. Releasing a little tension in the face. Inhaling up to 4, 1, 2, 3, 4. And exhaling back down to 1, 6, 5, 4, 3, 2, and 1. So moving on to headache relief for temporal mandibular joint dysfunction. We're going to do a little bit of compression and decompression for the mandible. So for compression, we're going to direct pressure in a superior direction, so upward above your head. And for decompression for your jaw, we're going to direct pressure inferior or down the body. So go ahead and bring your thumbs to the very bottom angle of your jaw, right where you feel that point in your jaw. And then take the rest of your fingers, probably just your first and second finger, and find that divot in between your mandible and your temporal bone. It's going to be a little close to your ears. So once you've found that divot, go ahead and make contact with that connective tissue, just pressing into the head. For compression of the jaw, start to direct your pressure upward, taking a deep breath. And exhale for decompression, moving your fingers down, taking that connective tissue with you. And whatever feels best for you, you can place your whole hand and take all of the connective tissue on the sides of your jaw with you. for compression and decompression. Or you can just place the tips of your 2 fingers in between the connection between your mandible and the temporal bones. So that's all I have for you today. Thank you so much for watching, and it was lovely spending time with you today teaching you how to give yourself some massage for your migraines and headaches while you're away from your therapist. Again, my name is Rachel Schmidt. I am a licensed massage therapist at Sequoia Wellness Center in Rootstown, Ohio, and we can't wait to see you all again. Thanks.